But COVID-19 virus is running rampant throughout the country. So the healthcare system is inadequate to meet that task. And so the prospects are grim.
From Jakarta and my kitchen table, I'm Jeff Hutton, and welcome to On the Level. Today, SARS-CoV-2, the virus that causes COVID-19, presents an almost impossible dilemma for the leaders of developing countries. Social distancing may work in the rich world where there's a safety net and where most people have homes. But what about in big emerging economies like Indonesia's? Its stimulus package this week is roughly 1% of the $2 trillion program announced by the United States. And how do you tell people to stay apart when your country includes Java, the most densely populated island on Earth? To talk to me about what sets Indonesia apart and the special challenges it faces, I'm joined by longtime Indonesianist Kevin O'Rourke. He's the author of Reformasi, The Struggle for Power in Post-Suharto Indonesia, about the protests that led to the ouster of Suharto. He's also the author of the highly regarded Indonesian intelligence brief, Reformasi Weekly. Kevin spoke to me earlier this week about how Indonesia, its fledgling democracy, and its meager health services may survive the coronavirus, and how the outbreak is shaping up to be a long-term public health threat. And Kevin O'Rourke, thank you so much for joining me.
Sure, my pleasure.
We've been speaking off and on for several years now. Elections, earthquakes, corruption scandals, and corruption scandals.
Mm-hmm.
How resilient do you think Indonesia is to the current shock?
Well, it does have several advantages that stand out. Unfortunately, the government response is squandering some of those. But basically, I would point out that Indonesia is less well integrated with global supply chains than other countries, which, when things are going well, is a disadvantage or a deficiency. But when things are going badly, that's a positive. But COVID-19 virus is running rampant throughout the country. So the healthcare system is inadequate to meet that task. And so the prospects are grim. A source of resiliency for Indonesia is the fact that it's an archipelago, and it's perfectly suited to severing transportation links and population movements between islands. But unfortunately, the government has not taken that approach. So,
just to round off that previous point, though, living memory, but it is still in the living memory of many Indonesians of a shock, an exogenous shock, causing people to take to the streets. It's not. It's still a living memory of tires burning on the tollway to the airport. We're past that, are we? Do we think, is there trust enough among the people in the government and their leaders that stability is assured?
Yes.
A qualified yes.
Yeah, I'm qualifying that just because, we're in scary times, and so it's definitely conceivable almost anywhere on the planet that real ugliness could become apparent at some point, whether that's clashes between locals and migrants from the city, or whether it's food riots. So it's impossible to rule out something like that. The problem I have with the comparison to 1998 is that that year was a remarkably peaceful protest against corruption, and the economic crisis had been underway for a full 6 months with drastic impacts on the population, and yet there was no violence whatsoever anywhere. And then there was deliberately orchestrated violence by elements within the military who wanted Suharto gone. And that's when there was the Trisakti shootings, the Jakarta riots, and the Semanggi shootings, all in rapid succession.
The Trisakti shootings
And
being the army shooting university protesters, right?
well, there was never any identification about who the perpetrators were, but it was trained snipers killed 4 Trisakti students.
Right.
Yes, and then the Jakarta riots ensued the next day. And that we've seen that recur because that type of orchestrated violence is precisely what unfolded in May 2019 when Prabowo Subianto rejected the national election result.
So it's not out of the realm of possibility, but President Joko Widodo, has the authority and the mandate, a popular mandate. We're progressed enough from that there's reason for optimism.
Yeah, I don't anticipate orchestrated violence as happened in May 2019 and May 1998, and therefore I think that there's no need for much concern about outright violence, uprisings, clashes with security forces, that type of thing. The only caveat being that if circumstances really become particularly dire, then food riots or looting, raiding stores is conceivable at some stage on a more local, low-level scale, I think.
So there have been a number of developments. The government has announced a health emergency, has urged people to stay home, especially in Jakarta, paroled inmates. And there's been talk of a lockdown. It was dismissed, I think, at the virtual cabinet meeting yesterday. What's your take on it? Should Jakarta be locked down, or it seems to me like shutting the barn door after the horses have bolted?
Yeah, I would agree. Lockdown is problematic in terms of semantics, especially when you have 2 different languages with 2 different sets of terminology to use. So there's
elaborate on that, because it has a different sense in Indonesian, doesn't it?
Yes. Well, the problem is Indonesians interpret the word lockdown in various ways, and even English speakers don't really understand what lockdown means. Different governments in different places around the world are taking different steps, all under the general rubric of a lockdown. So urging citizens to stay at home has already happened. And in fact, a lot of citizens are choosing to stay at home in Jakarta, regardless of what anybody in the government says, because they're well aware of the risks. So if a lockdown refers to closing off the borders of a specific region and preventing ingress and egress, in Indonesia would be referred to as a karantina wilayah, or regional quarantine. And that's been the topic of a lot of discussion in the cabinet back and forth, which has constituted a lot of wasted time. And the problem is that the law on the matter, which is a relatively new and quite well-written law from 2018, calls for the government to guarantee the livelihoods and food support and medicine for those people in a region quarantined. So that's something that I think the government is wary about taking on. It's regarded as too much responsibility. And so therefore they've held back from imposing a regional quarantine, but that decision appears to have also prevented them from ceasing air transportation out of Java, and that's a real tragedy.
Why is that?
Well, because locking down or severing transportation links out of the province of Jakarta is impossible, because there's tens of thousands of lanes and roads that one can use to get out, and 2, it's too late because the virus is already rampant all throughout West Java and much of Banten, and probably throughout the whole island of Java. But then you have the advantage of Indonesia being an archipelago, and so there was a clear opportunity for Java to just stop flights from Java to other islands in the country. And that would have been an ideal way to spare 40% of the country from the ravages of the virus, because it really could have stopped it from spreading. But that juncture was 2 weeks ago, and the step still hasn't been taken. People are still flying out of Java and landing in other provinces. And now what's happening is that some of the governments of these provinces outside of Java are asking to be able to close their airports down, or they're simply stopping flights from coming in the first place.
Well, we saw that in Papua, didn't we? I think
Yeah.
the governor
Yeah.
there asked to stop all air travel.
Yeah, he did, and at least one airline, Sriwijaya, complied. It's not clear whether other airlines are doing the same.
How was that request taken in Jakarta? I think with a certain amount of resentment, wasn't it?
Yeah, the Home Affairs Minister, Tito Karnavian, the former police chief, sharply criticized the governor and rebuked him for not complying with national policy, because that 2018 quarantine law does make clear that only the central government can impose quarantines. So if the governor's position is interpreted as being a quarantine of his province from the rest of the country, that is indeed illegal. So, the Home Affairs Minister is legally correct, but from a policy standpoint, he's wrong, because that policy of the Papua governor should be playing out across all of the islands outside Java right now. And the governor of Central Kalimantan is doing this as of yesterday.
But there's another element to this that I think would rankle sensibilities in Jakarta, right? I mean, any notion of sort of an independent move, anything that defies the unitary state, is met with at least skepticism, if not a sense of betrayal, right? It's not just the legal niceties, is that they just really feel that it's not your place and that you're threatening the unity of the country. There's an emotional element there too.
That is
Looking too
what
deeply, am I? Sorry.
No. That's exactly what I myself presumed and intend to assume. What's a bit odd, though, is that this position remains in place due to the actions of ministers who themselves are people from so-called outer island provinces off Java, like Luhut Panjaitan, who's from North Sumatra, and Tito Karnavian himself, who's from Sulawesi. So it's a head scratcher. Basically, the national elite generally tends to have a Java-centric viewpoint, and I think that there's been a lack of empathy for the provinces outside of Java in the past 2 weeks.
Got it. So no lockdown as we know it. But as you alluded to, certain regional leaders are making of this crisis in different ways, approaching this crisis in different ways. I've noticed drive-through rapid testing in West Java.
Yes,
that.
I mean, that's the encouraging aspect of what's been happening. The government's gone back and forth on its performance in responding to COVID over the past few weeks. It moved adroitly back in early February to halt flights in from China, but then the health minister downplayed the risks, and there was a lack of preparations. And then there was the creation of the task force under Donny Monardo, which was a positive step, and they brought in these fast testing kits, which are now being used in West Java. And in fact, they're being used in other provinces as well. From what I can tell, there's very sparse data at this time about exactly how many rapid test kits have come in and where they've gone. But these, of course, are not the polymerase chain reaction or PCR kits that examine the molecule. Instead, these are pinprick blood serological tests to find antibodies or antigens, and therefore determine whether a person has immunity to COVID because they already have it or they already had it in the past. And it's limited in what it tells you, but it's very quick and easy and relatively cheap to do, and it just illuminates matters for policymakers, because it really helps differentiate groups of the population. You can find out people who no longer need to worry about catching the virus, and they can then become frontline workers for you. So the West Java governor, Ridwan Kamil, has rolled this out on a very systematic scale in Bekasi and other cities in his province. And now other governors are doing so as well across Java. And they're testing patients and at-risk people first, and then healthcare workers, and then police and soldiers and other frontline civil servants who can interact with communities. And then there's drive-through testing that's also happening now, so that people can come and check themselves and find out if that cough they had 6 weeks ago was COVID or not.
Well, you made mention of data, and there has been a lot of concern that maybe the data is either lagging or lacking or been cooked somehow. What is your take on the veracity of the infection, death, and recovery rates? Because when I look at it, I didn't look at today's, but yesterday's, it was just over 1,400 infections. That seems really small to me for a place that's so densely populated, and possibly where an epidemic has been raging out of control for literally months.
Absolutely, yes. The numbers are certainly very understated. There's no doubt about that. Simply, mainly because there was so little testing done up until a few days ago. It was really not until about 25 March that the West Java governor really started doing the rapid testing. Until that time, there had just been a few thousand PCR tests done nationwide. So if you're looking at the mortality rate, that's the number of deaths diagnosed as COVID-19 in the numerator, and then the number of total infections detected and confirmed in the denominator. And in a lot of countries, there's a problem with the denominator being understated because not enough people come in and get tested or get diagnosed properly. In Indonesia, it's both the numerator and the denominator. I think there's a lot of deaths out there that are not even being diagnosed properly, much less cases of infections in the denominator. And so the percentage mortality rate for Indonesia is very inaccurate.
Well, the capital alone, they said that 283 people were buried over the month of March under COVID-19 protocols. They didn't know, for many of them, they didn't know whether they were infected, but they sure showed all the signs and died before they got the results of the test. I mean, that 283 is nearly, well, it's more than double at least the official death rate. I mean, that alone, and that's in Jakarta alone, that's got to be concerning.
Yes. So that's a worrisome indicator for sure, which is precisely why the survival of the rapid test kits is so important, because that can really serve to illuminate what's actually happening in the population. And initially, Indonesia took delivery of 150,000 rapid test kits from China on 22 March, and then
Where did they go?
there's been several 100,000 more come in since then. Well, they got them. They didn't say. It's unclear if it was a donation from the government of Beijing or whether it was a donation from a Chinese consortium of companies, or if it was a purchase or a loan or what. And in a way that doesn't matter, but on the other hand, it does matter, because it tells you whether these test kits can continue to arrive or not, because it's going to be important to have a steady supply of them, because one test kit can only perform so many tests, and so they're not
a bit like
reusable indefinitely.
Back with the broom,
Yeah, the good thing is that they have distributed them quite promptly throughout Java, and there are reports of district level municipalities performing tests on at-risk people and healthcare workers already. This is exactly the approach needed to differentiate groups, and then it enables authorities to conduct tracing. And Indonesia benefits from having an extensive state apparatus that can actually take on tasks like this.
How damaging has it been that the health ministry was headed up by Minister Tarawan, who, before the diagnosis of March 2nd, said that the lack of cases was because of prayer and divine intervention? I spoke with Minister Nafsio Mboy, former health minister Nafsio Mboy. I'm sure you remember from the SPY time era, the final 2 years of it. She said, I don't know what happened. I had access to a crisis center and scientists, and I had the information. It didn't look like he had I'm paraphrasing, but he said it didn't look like he had the information. Did he have the information, or was he just willfully negligent? What's your take?
Right, yeah, I think that he was a poorly suited appointee for the role of health minister from the outset when President Widodo chose the cabinet in October. And I guess that he approached the impending coronavirus pandemic with undue optimism and too much uncertainty about what policy responses would be appropriate and how to prepare.
We've seen a tendency, at least in the United States, of science taking a back seat and opinions coming to the fore. Are we seeing the same thing in Indonesia, a sort of a post-truth alternative facts approach to public health policy?
Well, I think with the initial response of Terawan Putranto, that was apparent. He's a very devout Christian, and that apparently affected his instincts and responses to coronavirus. He kept on referring to religious matters in relation to the pandemic without emphasizing sensible messages for the public about hygiene. But then finally, the president largely rectified the situation by forming the task force above the minister and putting in place the National Disaster Management Agency chair, Lieutenant General Doni Bernardo. And he's been far more sensible in his approach. He immediately set up a very effective and clear website and immediately started propounding the basic messages about hygiene, and also immediately brought about the arrival and distribution of the rapid test kits, as well as a substantial quantity of personal protective equipment for healthcare workers. So the health minister is still there on that task force. He's one of 4 people in an advisory capacity above the task force chair. And meanwhile, Terawan's handpicked Director General and COVID spokesperson Ahmad Yuryanto is also still visible, even though he was directly responsible for having downplayed the virus over and over again during those crucial weeks in February.
Well, what is the outlook, do you think? I have a bit of a theory that big countries, big emerging economies, like Indonesia, possibly Nigeria, and Brazil, and India, are never really going to fully contain the virus until there's a vaccine. Do you think Indonesia is going to be stuck with this? Until there's a treatment and a cure.
Yeah, I'm afraid it will linger for many months, maybe even a few years. A lot depends on what types of treatments and medications and vaccines come forth and how readily they become available for countries such as Indonesia. There also is the herd effect. So when enough of a population already suffers infection and fights it off and goes through the disease, then the rate of transmission, the R0 factor, diminishes quite a lot. So that that's a prospect that will arrive first in Java, presumably. But then remote areas of the archipelago, of which there's a vast number, will be suffering the impacts of this as it rolls out through the country over time, over the next year or two at least.
Yeah. Well, Kevin, thank you so much for this. I wish it was on better circumstance. How are you feeling? You're actually not in Indonesia. You're in the U.S.
Yes, I split my time, and I was due to come to Indonesia, but I postponed, and so I'm in a area of rural Maine and New England in the Northeast, and unfortunately, the policy response of the Trump administration is one of the few which is actually worse than that of the Indonesian government. The U.S. government has not even begun deploying fast test kits yet, and so there's just blindness about the status of the population, and so there's stay-at-home orders in effect throughout most of the country, and it's wreaking havoc with the economy here. But personally, myself and my family are just fine. We're very well situated for this.
I'm glad to hear it, Kevin. Thank you so much.
Yeah, sure thing. My pleasure, Jeff. Anytime. Look forward to doing it again.
And that's On the Level. Our producer is Stephen Handoko. Research by Imam Shofwan. And if you like us, share the pod with your friends. And follow us on Instagram at onthelevel_podcast. I'm Jeff Hutton. Thanks for listening.